CT scan is required for patients with minor head injury with any one of the following findings. Now, this applies to people with a Glasgow Coma Scale of 15, which means they have a full Glasgow Coma Scale, 15 out of 15. So this is people that come in, they're alert, they're awake, they don't have any type of, they're not slow thinking, they're alert, and everything is there. They seem like they're fine. Okay, so this is the patient population we're talking about. This isn't people coming in unconscious. This is people coming in fully alert, under their own power, answering questions. There you go. So, New Orleans criteria says if you have a headache, you should be going to the ER. I think that one's a little bit extreme. That one is one I take a little bit of liberty with. I'm not going to refer every concussion patient with a headache to go to the ER. I think that's a little bit ridiculous. But if any of the following are there, I'll start to think about it a little more seriously. Vomiting. So they use any vomiting. There's vomiting also in the Canadian CT head rule, but they say 2 or more episodes of vomiting. I cut it off at 1. If you've had a head injury and you vomited, I'm going to send you to the hospital just to let them deal with it. Being older than 60 years old, having drug or alcohol intoxication at the time of injury, having persistent anterograde amnesia. Anterograde amnesia is the inability to form new memories. So the incident happens, and you've taken the player off the field, or you've taken them by ambulance, let's say, to the hospital, or they come into your clinic, and they are asking people around them, why am I here? What happened? Or they say, I don't even remember the rest of the game. You're right, I got hit in the first half. I don't even remember the entire second half of the game. Well, that right there is anterograde amnesia. They're not forming new memories. They're alert, they're conscious, you're talking to them, they're asking you questions, but they keep repeating the same questions by saying, what am I doing here anyway? That is obvious anterograde amnesia, the inability to form new memory after the accident. And I would say persistent, anything, if they're still asking questions half an hour later, I'm taking them to the ER. Visible trauma above the clavicle. So anything above the collarbone that's visible as trauma. Okay, there's cuts, there's bruises, there's massive hematomas and things like that. Or the last one, if they've had a seizure. So to go through that again, CT is required for patients with minor head injury with any one of the following findings: headache, vomiting, older than 60 years old, drug or alcohol intoxication, persistent anterograde amnesia, visible trauma above the clavicle, and seizures. So you can see how that casts a fairly wide net, which for me and trying to make sure that my patients are going to be safe, I think that's fine. So we do use that.